No more talk. It is time to vote. That's the message President Donald Trump is sending to House Republicans tonight in the fight to repeal and replace Obamacare.
Yeah, the president wants a House vote tomorrow, but is the math going to be in his corner or not? KCON9 political reporter Dave Bryan joins us now with a look at the math and the president's gambit on one of his most significant campaign promises.
Yeah, no, unquestionably. So they were supposed to vote today. It got delayed. The vote tomorrow, not a big deal. But what happens tomorrow, now that really counts. After the scheduled vote on this was postponed until Friday, President Trump threw down the gauntlet to Congress. Either vote for the GOP health care plan tomorrow or forget about repealing Obamacare. That demand was reportedly delivered by President Trump's budget director, Mick Mulvaney, at a late-night meeting at the Capitol tonight, after which the Republican Congress members filed out.
We're going to win this. We're going to win this for the president.
The enthusiasm of Huntington Beach Congressman Dana Rohrabacher after a late-night meeting of Republicans at the Capitol flies in the face of reality that the GOP health care coverage plan, otherwise known as the American Health Care Act, is in deep trouble on the eve of a House vote now scheduled on Friday. Earlier at the White House, President Trump got a standing ovation from more than 30 Congress members in the Freedom Caucus, many of whom are still insisting they will vote against the Obamacare replacement plan, which the president is pushing hard. And in the midst of all this, White House Press Secretary Sean Spicer insisted the health care vote would take place on Thursday as scheduled.
It's going to pass, so that's it.
Oops. A short time later, it was announced that the showdown vote on one of President Trump's most important initiatives, repealing and replacing Obamacare, a vote the president wanted to take place on Thursday, the 7th anniversary of the Affordable Care Act, was going to be delayed until Friday. Most Republicans left the Thursday night meeting feeling good about the bill's prospects on Friday, like Bakersfield Congressman Kevin McCarthy, the majority leader in the House.
We're going to vote tomorrow. It's going to be great.
Are you going to pass tomorrow?
Of course.
But the problem with that is some of the most conservative Republican Congress members are under tremendous pressure from home to vote no.
I live in a conservative district, but I've got 275 calls opposing this bill and 4 calls supporting this bill. And that's half Republicans and half Democrats. There's literally no liberal or conservative constituency for this bill as it stands. So to stop the revolt on the right, President Trump agreed to the House Freedom Caucus's request to reduce the cost of health care by dropping the Obamacare requirement that insurance companies agree to cover essential health services, including hospitalization, maternity care, prescription drugs, mental health, and substance abuse services. In other words, cheaper plans could now be offered because they won't cover many of the most basic health care services that most people need. But stripped-down health plans like that wouldn't do much to help Tawana Thomas, who joined a rally in downtown L.A. to save the Affordable Care Act.
You know, I'll be back tomorrow, the next day, and the next day, and the next day, because I'm so worried about it. I can't even sleep at night.
The mother of 4, Ms. Thomas says she suffers from seizures.
I take 3 medications, and I won't be able to afford my medicine. I will have more seizures.
By cutting out the requirement that essential health services be covered, President Trump is betting that more moderate Republicans won't change their minds now and vote no on Friday.
If they put this up for a vote, it's going to pass.
Why do you say that?
Because if you are a Republican, you have one choice. You're either going to vote with Donald Trump to repeal and replace Obamacare, or you're going to vote with Nancy Pelosi to defeat the only bill that will repeal and replace Obamacare. And if you're a Republican, that's a pretty simple choice.
Responding in kind, San Francisco Congresswoman Nancy Pelosi, who shepherded Obamacare to passage, had some unsolicited advice for President Trump.
You build your consensus in your caucus, and when you're ready, you set the date to bring it to the floor. You may be a great negotiator. Rookie's error for bringing this up on a day when clearly you're not ready.
Now, even now, with the ultimatum from the president and the elimination of those essential health care services from the mandate, it's still not clear this bill will be approved by the House tomorrow. At last count, the leader of that Freedom Caucus, the conservative group, said about 30 to 40 Republicans still planning to vote no, and House leaders can afford to lose only 22 Republican votes if the bill is going to pass. Lena, back to you.
Yeah, so Dave, clearly the president has a lot at stake tomorrow, so give us kind of the short list of what this vote is going to mean here.
Yeah, it's a long list, but the most important things are, number one, of course, if the bill does pass tomorrow, the president will be hailed by Republicans and his other supporters as the closer, the president who was able to begin the repeal and replace process for Obamacare in 60 days. But if it loses tomorrow, it will weaken President Trump in a significant way. Because remember, this is his first high-profile legislative vote in Congress. It will test his tendency to go for revenge and get into verbal brawls with those who oppose him afterward, and that could be another distraction to getting things done. And finally, Congress respects strength, and a loss tomorrow will focus the public on President Trump's weaknesses, making it more difficult for him to pull the levers on Congress. Jeff, back to you.